Today's date is January 26, 2019. This is Dr. Alden Williams from Texas. He is a board certified anesthesiologist and pain specialist. So we were really honored to have him here at our quarterly workshop for ozone. Alden, you're a specialist, highly respected, extremely highly trained, and you've already been doing ozone therapy. What are your comments on the workshop this weekend?
Well, first of all, I'd like to say I'm actually the one that's being honored to be in the presence of, Dr. Robert Rowan and Dr. Howard Robbins. I did DIV ozone therapy with Dr. Robbins about a year and a half ago, and before that, for the last three to 4 years, I've been doing intraspinal ozone injection and also periganglionic injection, just like they've been doing in Italy and in Europe for over 40 years. They've probably done over 50,000 cases, in certain areas with tremendous success for intraspinal and intradiscal ozone. So I got into the ozone world from a spinal perspective, and then once I started doing the intravenous ozone, it actually blew my mind as far as the results I've been getting and the kind of medicine I've been practicing for 23 years. So for 23 years of practicing conventional medicine, and I've been pretty much conventional, using steroid injections and anesthetic and radio frequency rhizotomies to do destructive procedures.
Destructive.
Which, I thought that was the way to go. But when I got introduced to ozone, when you do ozone therapy, it is just the amazing results that kind of like baffles the mind in how this has been a forgotten, or not even a forgotten, an undiscovered therapy.
And ignored.
In the United States.
Ignored.
So my response to how the workshop has been, it has been fabulous. It has been probably the best CME, which I probably will not get any credit from my specialty,
right,
for being here. But this CME that I've gotten with Dr. Rowan has been incredible. The teaching has been superb. The response that he has to the students, and I consider myself a student of ozone because by no means I'm an expert, because that's why I'm here, to be taught by the world's best ozone therapist. So as a conventional guy that I've done a lot of spinal injection under fluoroscopy, under x-rays, under CAT scan, it is quite shocking to see the results that he has been getting without imaging studies. Now, that's not to say I'm going to be doing it without imaging study, because I still think imaging is the king. But when you don't have it and you don't have access to it, his technique that he teaches, from my perspective, knowing what I see when I do injection under imaging, is excellent. The way that he does the knee joint injections by palpation, and then injecting and feeling the gas on the opposite side of the knee, is an excellent method. Now, I would not recommend, if you were going to inject other substance like PRP and umbilical cells, which is very expensive, you should probably do that under imaging, because you want to make sure you're 100% in that joint. But the technique that when you're injecting a gas and you can palpate and do it, I see no issues at all as far as his ability to get into a knee joint and feel the technique that he does. So it's been a very, great experience. I saw hip injection, shoulder injection. I had him do my sacral hiatus. And as an anesthesiologist, he did my caudal injection from the sacral hiatus approach. And it was done with local anesthetic, and it was done smoothly. And trust me, I've done a lot of sacral hiatus injection and caudal lysis of adhesion. So it was really remarkable. And that's the first time anyone has ever put a needle in my spine, ever. And it was very, very good. So this workshop has been fabulous. I would recommend this highly. And I was actually very pleased to see another PMNR, pain management specialist trained here, because when I've been to Aruba at the Ozone Without Borders, there were no pain specialists there, no pain doctors are there. And it's sad, because when I talk to my colleagues, when patients go and tell their other doctors what I've been doing, they look at them like they're like Martians with 4 heads and 9 eyeballs. Like, you had them do what? So the results of these treatments and the future of ozone, I'm hoping that I can contribute to the long-term future of it. I'm going to try to get more and more involved as much as these guys will let me hang around them and pick their brains, and I'm sure they want to pick my brains for what I do.
Was it worth the cost?
Absolutely. And I was skeptical about coming for the first day because the first day was ozone. And I was a little skeptical because I'm an interventional anesthesiologist and I do injections in every single part of the body.
Right.
I've been in every joint, every tendon, every spot that you can possibly imagine. When he does TMJ injections, fantastic approach. Shoulder, hips, knees, ankles, spinal. He does some paravertebral injection where he injects ozone into the facet region. I'm not going to say the facet joint because he's in the region of the facets. The technique is fantastic because the ozone actually spreads. And when I've done the ozone injection using fluoroscopy, I can see the spread along the paravertebral muscles and along the facets, that it spreads very easily. So I can actually imagine when he's doing it with that technique that I know he's getting a spread. So you're going to infiltrate the area and you're going to get some results, with reducing inflammation and circulation in the area. So it's a fantastic approach.
How's the food?
Fabulous. I actually turned part vegan, for the new year so I can lose some weight. And the food has been fantastic. His wife is wonderful.
Thank you. May I post this on YouTube?
Absolutely.
Thank you. And for the viewer, this is Alden Williams. What city are you in?
I'm in two cities. I'm in San Antonio and Bernie, and I have a website, Apple, S Sam, P Peter, M .doctor.com. Advanced Spinal Pain Management Doctor.com. ASPM.doctor.com.
I want the viewer to know that I am honored that you came. You're a pain specialist, ozone using, and you really got a lot out of this. So that's an honor to me, number one. Number two, I want the viewer to know that yes, I have failures as everybody does, and I am so delighted to have met you, an anesthesiologist who can use radiographic techniques, fluoroscopy for directed needle injection, and you can inject discs. That's one thing I can't do. I have no power to do that, and I do have patients who need that, and I'm ecstatic to know you because now I have a place I can refer patients.
I'm looking forward to it.
And an ozone-using doctor who's very comfortable with it. So thank you so much for being here.
You're very welcome. It was my pleasure.